Here is your stem. So once you're ready, please let me know. We'll.
Yes, ma'am. I am
Okay.
ready.
So, right here. If you have read and understood, considering it anatomy station, please tell me if you could look at this picture B, this one, and here just suppose not looking at the marked structures. I want you to tell me if this is the arm of this person. Please tell me how many compartments there are and which muscles are in which compartments.
Ma'am, arm has two compartments, anterior and posterior compartment. And in anterior compartment, muscles are bicep brachii, coracobrachialis, and brachialis muscle. And in posterior compartment, muscles are tricep brachii.
Only. Okay. Right. Now this part, if I ask you to focus on this part between D and E, what is the name
Yes,
of
ma'am.
this part?
Ma'am, this is the anterior aspect of the elbow joint,
Okay.
and it
All
is
right.
named cubital fossa.
Okay. Right. We'll come to cubital fossa in a second. Can you identify these structures A, B, C, D, and
Uh,
E very quickly?
Ma'am, represents the brachioradialis muscle,
Okay.
and E is representing, ma'am, tendon of bicep brachii, and B is representing palmaris longus, and
Okay. Please tell me how muscles are structured in the forearm between D to here.
D2 here.
So how
Ma'am,
muscles are structured in the forearm of any
in
human being?
muscles are structured in superficial and deep parts, and in
In the
superficial,
forearm. Okay. So this is the which surface are you telling me?
this is superficial
But
superficial
oh,
muscles.
yes, but there is posterior compartment and there is anterior compartment.
Yes, ma'am.
So
This is the
in the
anterior.
yes, so in anterior they are structured in superficial and deep. Which muscles are in superficial compartment and what are the muscles which are in deep compartment?
In ma'am, superficial compartment, the muscles are pronator teres and flexor carpi radialis, flexor carpi ulnaris, palmaris longus, flexor digitorum superficialis, and in deep compartment, the muscles are flexor digitorum profundus and pronator quadratus and supinator.
And what about the back?
And in back, the muscles are uh, uh, extensor.
No, how many
Uh,
compartments there are on the back side, on the dorsal surface of the forearm?
uh, two, ma'am, two compartments, and in superficial are flexor digitorum, extensor digitorum, and extensor indicis, and in deep muscles are abductor pollicis longus and extensor pollicis longus and extensor pollicis brevis.
How many reflexes could there be in the upper limb?
Ma'am, in upper limb, bicep reflex, brachioradialis reflex,
Please tell me the root value as well.
and bicep reflex C5, C6, and brachioradialis reflex is C6, and tricep reflex is C7.
Triceps reflex is C7 and there is spinator reflex. Which one is that? And how do you check that?
Sorry, ma'am. Spinator.
It's C6, okay? Located 4 inches proximal to the base of the thumb.
Okay, ma'am.
And right, okay, if you could tell me the origin and insertion of the triceps muscle.
Triceps long head has origin from inferior glenoid tubercle, and lateral head has origin from the lateral aspect of lateral posterior aspect of humerus, and medial head has origin from the medial aspect medial posterior aspect of humerus.
Okay, please tell me the insertion of the biceps muscle.
Bicep brachii has insertion in tuberosity of radial tuberosity.
Yes. Good. And please, okay, right, moving back. Wait here. Please tell me what are you looking at and identify the structures, please. What are you looking at and what are these structures? A, B, C, D, E, F, G, H, lateral and the medial, please.
This is the cubital fossa.
Please
And
tell me the boundaries first.
B representing the pronator teres, and G representing the brachioradialis, and the cut line representing the imaginary line representing the base of the cubital fossa, and A is representing the median nerve, and E is representing the brachial artery, and F is representing the bicep tendon, and D is representing the cephalic vein, and C is representing the ulnar artery, and H is representing the radial artery.
Can you identify basilic vein here?
No, ma'am, basilic vein.
Where exactly it should be?
It should be, ma'am, on the medial side.
Yes. Where exactly? Here somewhere.
Yes, ma'am.
Why it's not present?
Yeah, it travels on, slightly on the dorsal aspect of the forearm. That's why it is not represented here.
No. Okay. You have not told me the boundaries of the cubital fossa.
Ma'am, pronator teres represent the medial boundary, and brachioradialis represents the lateral boundary, and the imaginary line between the condyle of the humerus represents the base.
So floor is formed by brachialis.
Yes, ma'am. Floor is formed by brachialis, and roof is formed by bicipital aponeurosis.
Yes. Okay. Right. Here, what is important or why cubital, what is the significance of knowing the structures in cubital fossa?
Because we get the access so to the superficial veins mostly here, and we can also get access for the cardiac interventions from here.
Okay, thank you. Okay, thanks.